Hello, welcome to my YouTube channel, Brand Black 2 TV. And in today's video, I'm going to share with you the dental health terms, the teeth structure, and the signs and symptoms of cavities. Remember, with my YouTube channel, Brand Black 2 TV, I also upload videos on different subjects, videos in relation to technology, videos in relation to relaxation music in terms of music that can relax your mind after a long day's work, music that can help you meditate, music that can help you during your quiet time as you're having Bible, music that can help your kids try to sleep, lullaby music for kids that have failed to sleep. That is all in the package of the relaxation music with my channel. More so, I also upload videos in relation to different tutorials concerning different subjects. For instance, cover topics on how to use your Android phone to install apps, how you can edit your YouTube channel, among other ways you can use your Android phone to be in position to access the internet, in position to solve complex tasks without a desktop or a laptop. More so with my channel, I also upload trending and current information that will be helpful to you, trending news, that is with my channel. And more so, I do have teachings in relation to health, how you can keep a healthy body, how you can in position to improve in terms of health, such that you're in position to live longer. Remember, not forgetting above all, I do upload non-stop music, especially when it comes to the gospel music. I do upload gospel music that is good for your praise and worship, music that you can play at the comfort of your home as you meditate, as you have your quiet time with your Father, Creator in heaven. Best music that you can enjoy. Lyrics, I also provide. This channel also provides that lyrics of various songs that can help you sing along, and get acquainted with the words within the songs. So for all those that are new, those that are watching, that are viewing, please endeavor to subscribe, like, share, hit the notification button. Brand Black 2. Thank you very much. God bless you.
Now let us go straight to the dental health terms, starting with tooth decay. Tooth decay is the damage to a tooth surface or enamel. It happens when bacteria in your mouth make acids that attack the enamel. Tooth decay can lead to cavities or dental caries, which are holes in your tooth. If tooth decay is not treated, it can cause pain, infection, and even tooth loss. Now, we are going to look at what we call a gum disease. Gum disease is that occurs when germs in the plaque infect the gums, causing them to become red and puffy and to bleed easily. In severe cases of gum disease, the infection can spread to the supporting bone around the teeth and loosen them, and over time, you may lose your tooth. If plaque is left on tooth for a long time, it can become hard, and this is called calcus or tartar. This cannot be removed with a toothbrush and must be scraped off by a dentist or oral health professional. Let us look at the next term. It is called the alveolar bone. Alveolar bone is that bone surrounding the root of the tooth, anchoring it in place. Loss of this bone is a possible sign of periodontal gum disease. So that is the alveolar bone. Now, looking at the next term is what we call the amalgam. Amalgam is a common filling material used to repair cavities. The material, also known as silver fillings, contains mercury in combination with silver, tin, copper, and sometimes zinc. That is the amalgam. The next term that we're going to look at is the anaerobic bacteria. That is the bacteria that does not need oxygen to grow. They are generally associated with periodontal disease. That is the anaerobic bacteria. The next term that we're going to look at is the analgesia. Analgesia is a state of pain relief, an agent for lessening pain. That is analgesia. Then the next term that we're going to look at is what we call anesthesia. Anesthesia is a type of medication that results in partial or complete elimination of pain sensation. Numbing a tooth is an example of local anesthesia. Then the next is what we call the enamel. The enamel is the hard mineralized material that covers the outside portion of the tooth that lies above the gum line or crown. The next that we're going to look at is extraction. Extraction refers to the removal of a tooth. That is, whenever you remove a tooth, that process or term is referred to as extraction in the dental health terms. The next term that we're going to look at is filling. Filling is the restoration of the lost tooth structure with metal, porcelain, or resin materials. The next term that we're going to look at is fistula. Fistula is the channel emanating pus from an infection site, that is a gum boil. In the next term that we're going to look at are the sealants. Sealants, these are thin, clear or white resin substance that are applied to the biting surfaces of the teeth to prevent decay. That is the sealants. They are silverish in color. The next time that we're going to look at are the stains. Stains can either be extrinsic or intrinsic. Extrinsic stains are those stains located on the outside of the tooth surface, originating from external surfaces, substances such as tobacco, coffee, tea or food. Then the other kind or type of stains are the intrinsic stains. Intrinsic stains are those stains that originate from the ingestion of certain materials of chemical substances during tooth development from the presence of caries. This stain is permanent and cannot be removed. That is the intrinsic stains. So basically, when we talk about stains, they are two in nature. They are basically extrinsic, those that are outside, and intrinsic, those that are inside. So you need to consider that. So for all that are viewing, please endeavor to hit the subscribe button, like, share and comment. So basically now looking at the next type of term that is used in the dental health care is what we call the supernumerary tooth. The supernumerary tooth is that extra tooth. Basically, an extra tooth is what is termed as the supernumerary tooth. In the next term, we are going to look at what is called tartar. Tartar is a common term for dental calcus, a hard deposit that adheres to teeth, produces rough surfaces that attracts plaque. That is tartar. The next is teething. Teething, that is baby teeth pushing through the gums. The next term is the root canal therapy. Root canal therapy is the procedure used to save an abscessed tooth in which the pulp chamber is cleaned out, disinfected and filled with a permanent filling. The next is what we call the root. The root is the tooth structure that connects the tooth to the jaw. So basically endeavor to subscribe, like, share and comment. Looking at the signs and symptoms of cavities, the signs and symptoms of cavities vary depending on their extent and location. When a cavity is just beginning, you may not have any symptoms at all. As the decay gets larger, it may cause signs and symptoms such as toothache, spontaneous pain, or pain that occurs without any apparent cause, tooth sensitivity, mild to sharp pain when eating or drinking something sweet, hot or cold, visible holes or pits in your teeth, brown, black, or white, staining on any surface of a tooth. Pain when you bite down. Note this. You may not be aware that a cavity is forming. That's why it is important to have regular dental checkups and cleanings even when your mouth feels fine. However, if you experience a toothache or mouth pain, you need to see your dentist. So basically, things to note is that you need to always take a regular checkup and always visit your dentist. In the next video, we are going to see the causes of tooth decay and the risk factors. So in the next video, be expectant about learning on the causes of tooth decay and the risk factors. Please endeavor to subscribe, like, share, and comment. Thank you. Brand Black 2 TV.